Since the outbreak, events surrounding it have brought the records management into increased focus. This informed the crux of the retirement meeting of the outgoing registrar of the Health Record Officers Registration Board. They dwelt on the key role played by the medical records officers in the effective tracking and tracing of patients during the pandemic, which in turn played a huge part in Nigerians' response.
Anytime you find yourself in the hospital, there's first people who see, and the job of those people is to issue cards. So in those days, they call them cards issuers. So those are the people now that we are now referring to as head record officers or head information manager. And from there, they will now start to say, what actually did they do? And we told them, yes, they do issue cards, they do document patient, they do collect data, and at the end of the day present this data and analyze this data, and they will be able to tell you who come to the hospital, what are the conditions that lead them to do so, and can also trace you. That, of course, has even helped a lot in identifying where we have some epidemic, and we can now use that data to even identify or locate the patient. You know, during the COVID, we have what we call a monitor and surveillance group that they will go around. If a patient is absconding, people travel to our abroad and they come back, they did not follow this, they can trace them. Those tracing is the record people that are doing that, providing those information during the documentation. At least you have your identity. So we'll now be able to recognize, and it's now become a full professional entity. So
the board says this brought about the ability of the healthcare system to face the COVID-19 pandemic with efficiency in maintaining medical records to improving the quality of healthcare services.